So we are moving right along to our first presentation, which is a dermatology presentation by a tag team, Doctors Torga, Kirkorian, and Abraham. And I'm not sure who's going first, but we're on. Or you all going together? Highly choreographed for you all. The mic is here. The green button advances the slides. The red button goes back. All right.
Good morning. I'm Anisha Abraham. It's wonderful to be here so early in the morning, and thank you to all of you that are here so early as well. I'm Chief of the Division of Adolescent Medicine, and I'm going to just start our talk this morning with a show of hands. So how many of you are on a social media platform, whether that's Facebook or Instagram or TikTok or anything? How many of you take care of a teen or tween patient, or maybe have teen or tweens at home that are on a social media platform? How many of you maybe know a teen or tween that's come in for a healthcare issue, particularly related to their skin or acne? And how many of you have a teen or tween that is using social media to get their healthcare or skincare information? All right, well, I guess we're in the right place to answer some questions that you may have related to that confluence, again, of skincare routines and certainly what young people are doing in the age of social media. And I'm really delighted to be here with my colleagues, Dr. Kirkorian, who's Chief of Dermatology, and Trisha Torga, one of our adolescent fellows. And I'm going to turn it over to Dr. Torga to continue on with the case.
All right. Hi, everyone. Good morning. So we'll start with a case. So let's call our patient Sally. She's a 13-year-old girl who comes to our clinic with concerns of months of acne that's just not improving. We know that she follows a lot of many popular beauty influencers on TikTok and Instagram, and she's tried a lot of over-the-counter products that they've been recommending, but nothing has been working. Instead, now she's noticing worsening self-esteem, worsening anxiety, and trouble sleeping because of how much time she spends worrying about her skin. So I don't know if this case is familiar to you all, but when you see this case, I just want you guys to recognize that this is not just a skin issue, but it's also a mental health issue and a media literacy issue. So as we go through our presentation today, let's keep Sally in mind and think, what would you do and how would you counsel them? And it sounded like from the raises of hands earlier that you have seen similar cases like Sally, and that's pretty accurate. Up to 12% of outpatient pediatric visits are for skin-related concerns, including contact dermatitis, eczema, and acne. And generally, 70% of this dermatologic visits are seen by non-dermatologists and in the primary care setting. But the question is, where are kids getting their skincare information from? So these are the answers that came up, but I just wanted to check in. Do you think they're getting it more from us or social media? And I just also want to raise the hands too. Do you think it's from us healthcare providers that they're getting most of the information? Oh, wow. How about social media? Yes, so you got it. Our patients are turning to social media influencers and beauty contents as their primary sources of information based on a study. And they're then comparing themselves to skin ideals that influencers are posting, and they're copying this elaborate skincare routines that they're finding on TikTok and YouTube, which often feature products that are not age appropriate because they contain products like retinols, exfoliating acids, and anti-aging serums. So today, our talk is about helping you guide kids towards safe, age-appropriate skincare while also helping them feel more comfortable in their body and develop a healthier relationship with the online world that's shaping their self-image. So our objectives for today is we want to show you what they're currently seeing on social media, review evidence-based acne management, and discuss the role that social media plays in youth mental health and how we could counsel our patients and families. So how big is this problem? Well, it's not a problem, I guess, but skincare is a $14.5 billion industry in the US, and kids aged 6 to 17 years old account for a third of that market. I think that's a huge share, and it is still growing. This trend is largely driven by social media influencers and skincare marketing campaigns that are now actively targeting young people. Have you ever searched skincare for kids and teens online? Because apparently there's a lot now, and these are the brands that you will see. And as you could see, they're very geared towards the young audience. They're colorful, they're partnering with Disney, they're giving out kid-friendly accessories, and this targeted messaging is clearly working. Gen Alpha is buying more facial skincare products at a growth rate that's higher when compared to the general market. And the thing is, they're not just picking up moisturizers or sunscreens, they're also reaching for toners and treatment products. And as you could see in the graph, the biggest jump in purchase among teens and tweens is in toners. So I don't think it's unlikely that a patient will ask you, do I need to use a toner? Or what kind of toner should I use? And we're like, it's so it's important for us to know that they're not all the same, right? Some may be okay because they're gentle or hydrating, but it's important to know that a lot of the toners that they see online actually have a lot of harsh chemicals like astringents and exfoliants, and they may be too strong for young, sensitive skin, especially when they're using it daily. And how much is it really costing them? So this is the hashtag GRWM, or Get Ready With Me video by YouTube and TikTok influencer Mariah Scott. For benefit of time today, I'm gonna not go through the whole video, but I'm just gonna share that in this video, she showed herself doing her skincare routine. It's like a 4-minute video, and highlighted all the products that she used. And let's go through those products. She used the cleanser, she used the moisturizer, and she used the niacinamide toner, she used a serum, she used another serum, and she has a lip balm. And for this 6 products, that's a total of $125. Even I think that's expensive, but did you know that that is actually the average yearly spending for skincare for teens and tweens last year? And this skincare craze isn't just affecting family spending. When social media is their main source of skin health information, they're putting themselves at increased risk for skin irritation and possible worsening of their existing skin condition. And it's important to see that it's also impacting how kids see themselves. It is developmentally appropriate for adolescents to compare themselves to others, especially their peer groups. It's part of our identity formation, and that's how they build self-image and self-esteem. But imagine how difficult that is when they're exposed constantly to this adult beauty standards, and when they're comparing themselves to these influencers with professional editing tools that are posing as their peers. And now actually to look at what they see on social media, let's go through some of the viral skincare hacks that for acne treatment on TikTok, and we'll assess if it's fact or cap. And if you're not fully fluent yet in Gen Z slang, cap just means not true or a lie. So these are the 4 things that are trending or viral at some point on the internet. First one on the upper left is pimple patches turn cute and colorful. This one is fact, but with a caveat. It can be helpful in isolated breakouts, but kids should be warned not to use it on freshly popped pimples or more severe acne because it could cause bacterial trapping and actually slow down healing. Next one is on the bottom of that for food products tagged as natural treatments, specifically beef tallow and garlic. This one is cap. These are food products that should remain on the plate and not be on their faces. Beef tallow is actually comedogenic, and it could block pores and worsen their acne. Meanwhile, garlic, when they rub it on their active pimples, and it increases irritation and causes blistering. Next up is light therapy, specifically getting a sunburn or using a handheld acne light therapy device like on the photo. Sunburn, hope it's common sense, totally cap. While the acne light therapy device is a toss-up. It's true that dermatologists, maybe we could confirm with Dr. Kirkorian later, they use light therapy sometimes for acne, but sunburn is an unsafe way to do that. And it can increase risk for wrinkles, skin damage, and skin cancer. And as for the device, it may be effective to a limited extent, but it's very expensive. And the worry is that for kids, they're marketing this as an instant cure, and that there are a lot of knockoff products out there that are not regulated and may be unsafe. And the last one is Korean skincare products. This one is toss-up. Toss-up because they may have some evidence-based ingredients and they should work, but they're not necessarily better than what we have here. And they're coming with a premium price because they rode an airplane. It also promotes the idea of achieving that Korean glass skin, which often leads to unrealistic standards and ignores genetic predispositions to certain skin types. So I said a lot of things that they shouldn't use. So for my last slide, just going to share what an age-appropriate skincare routine could look like. First of all, abide with the 2 rules. 1, keep it simple. 2, use gentle products. So before puberty hits, a 3-step routine with a cleanser, cleaning their face, moisturizing, and sunscreen for protection is all they really need. And once puberty happens and those sebaceous glands start developing more, that's when you could consider adding other products like toners or serums. What's going to be important is to familiarize yourself in the gentle active ingredients and what specific care needs they address, and like what's on the screen. And this is a recommended order of using this in products, and how you would give the instruction is that for every step, you let it dry before moving on to applying the next layer for the next step. So that's it for me. I wanted to hand it off to our dermatologist to talk more about acne treatment.
Okay, thank you so much, Dr. Torga. Thank you, everybody, for having me today. My name's Yasmine Kirkorian. My part of the talk will focus a little bit more on the details of medical therapy of acne, and I'm happy to take questions afterwards because there's going to be a lot of meat here. Okay, so what actually causes acne? I think this is important because a lot of our treatments are driven by the pathogenesis. So there is an increase of sebum production driven by the androgens of puberty. We get hyperkeratinization of the hair follicle, and that physically is seen on the exam as a comedone. Okay, so an open or closed comedone. There's plus minus inflammatory involvement, and that has to do a little bit with reaction to the bacteria called C. acnes that is resident to the follicle, or also to rupture of the follicle, as you can see when you have that keratin formation. So when you look at our medications, they're all targeting either parts of this or all of these pathogenesis. But what do our patients think cause acne? They think it can be hygiene, certain food products, an underlying disease, and there is truth and fiction in that. And it's important to kind of go through that with patients, because if they think, oh, I have to scrub my face more, which is not the case, you're really not going to get the benefit that you need. I'm going to touch on diet and acne. This could be a 30-minute or hour-long lecture, and I'll refer you to these papers that I've listed here. This is a common question from patients, and like anything in life, like yes, but complicated. So diet affects acne in the sense that a high glycemic load foods tend to have the most impact. So things that you know are not healthy for you in general also worsen acne through this insulin growth factor pathway, leading ultimately to increase in sebum production. So we definitely can counsel, like we always do, on healthy diets, but it's much easier to just say like eat healthy than to actually make those changes, which you guys are better at than me. So you can give that information, but oftentimes acne, by the time it comes to the dermatologist, the severity is such that just trying to do dietary modification alone will not be sufficient. So I view this as an adjunct, but it is important because this is something our patients think about in great detail. I'm not going to get into it here, but there are also this whole category of so-called nutraceuticals, which are these products derived from food. And whether they help or not, the help is kind of questionable, but for mild acne, certainly something you can consider, things like zinc and so on. Okay, so I think we all know this, but the history is critical in all parts of our careers, and I think acne is included there. So when did their acne start? Somebody who begins with very early acne at age 8 or 9, especially if it's severe, likely they're going to need a more aggressive treatment. Did their parents have severe acne? So I'll say, well, did you have to take isotretinoin Accutane to the parent? That tells you this kid is more likely genetically to be predisposed to severe acne and is going to kind of put the severity in that context. It's very important to the patient to express to you that today is a good day. You're not seeing it at its worst. And that is something that I'm like, I understand. And you want to hear that because they feel like I've waited so long for this appointment and now you're not seeing it as it is. What are the locations of the breakout? So truncal involvement to me always indicates moderate severity, unless it's like a dot, because typically you're going to have that facial predominance. So if you have oftentimes truncal involvement, especially if it's severe, even compared to the face, I'm thinking I need to be more aggressive. Are there marks left behind? This is particularly a question for our patients of color where that post-inflammatory hyperpigmentation can be more problematic than the acne itself. And if we're not addressing that, then they're going to feel like that problem has not been heard. What have you done? A thorough medication history. And obviously, as this talk is talking about factor cap, you need to ask about the over-the-counter medications, TikTok, all the stuff that we're talking about. What about your hormonal component, especially menstrual history is critical for our female patients. So let's look at the physical exam and think about how that's going to drive our treatment regimen. So mild acne means that it's primarily comedonal. Comedones mean blackheads and whiteheads. You may see 1 or 2 inflammatory papules, but it should really be limited. We're talking about primarily comedonal acne here. And the mainstay for all acne, the foundation, no matter what the severity, is going to be the synergistic combination of a topical retinoid and benzoyl peroxide. We'll get into those in more detail. But these are really critical things that every person with acne should be using. Moderate acne, we're talking now about more inflammatory lesions, papules and pustules, perhaps some cysts, but should really primarily be inflammatory lesions as indicated here. You can see a jawline predominance, especially in hormonal acne, which will be inflammatory but have that menstrual flaring. At this point, we're starting to think about what am I going to augment here? Can I consider an antibiotic? We'll talk about the course of that and which one I would choose in the next slides. Severe acne is characterized by the presence of any scarring. So for me, even a little bit of ice pick scarring puts you in the severe category because you have permanent damage to your skin. And for scars, we mean texture change, not pigment. Obviously, severe nodulocystic acne on the top there, I think any of us would agree is severe, but the lower photo where we see a person of color with significant post-inflammatory hyperpigmentation, that's also severe. She's devastated by this, not feeling comfortable. This needs to be addressed. And in this case, we're really thinking about the fast train to isotretinoin, unless we're seeing a hormonal predominance, and then we may be using OCPs and so on. It is super important as we're partnering with you as pediatricians and primary care providers that you try to do all these steps before isotretinoin, before they come to our office, because then we can get the party started if you're not yourself providing isotretinoin. If they come to us with severe nodulocystic acne and all they've ever had was 1 benzoyl peroxide wash, then we're starting from the beginning. We cannot get the isotretinoin from the insurance company because we haven't tried and failed those precursors. So even if you're like, I know this person's going to need isotretinoin, why am I going to bother? We're bothering because we have these check boxes that we need to do to get the drug covered. Okay, so we're going to go through our little textbook, what medications we recommend from a medical standpoint, and I'll let my colleagues continue to hit up on the TikTok. So benzoyl peroxide has multiple mechanisms of action that you can read about here. They are leave-on products and washes. I prefer washes, particularly for trunk and back. You do not need the higher strength products. I like the lower ones, the 4 to 5%. They're equally effective. They come in different vehicles that can be moisturizing. They can be irritating and leave some bleaching of towels, so you want to give that information. But this is a really good product. It's over the counter, important for everybody with mild acne to be using and more severe acne. Topical retinoids are the fundamental mainstay of treatment of acne. There are FDA approved from 9 and older, as you can see here, but we use them even in infants with mild, with infantile acne, which is very rare, which is off-label, but there is safety and data for that, or for molluscum used off-label and so on. So you certainly can treat pre-9-year-old children that are younger than 9. The devil is in the details. With dermatology, if we do not provide instruction on how to use the medications, they will not use them. They will tell you it didn't work or that it burned their face and then throw it away. So I'm not going to go into great detail here, but there are tons of handouts from our society that are free online. You apply a small amount to the full face, not spot treatment, and a few nights a week and slowly build up. And that counseling is a key part of where you might have felt like, well, I tried this and it didn't work for my patient. It's just really in how they used it. Clindamycin, I almost never use. I think I've prescribed it 0 times in a decade for acne. Why? Because clindamycin monotherapy leads to C. acnes resistance very quickly. And children don't like the retinoid because it's irritating, and they do like the clindamycin because it isn't. So that's all they put on. So I don't like to cause bacterial resistance and, futile care. I don't use this. There are combo products. They're kind of expensive, which have benzoyl peroxide and clindamycin that can be good for spot treatment. So for certain people, I'll use that, but that's very uncommon. Okay, antibiotics. So we know that there's a great overuse of antibiotics in medicine. Dermatology is a big problem with that. We're one of the main prescribers because of these chronic disorders such as acne, rosacea, and so on. So Our consensus guidelines do not support use for longer than 6 months. I don't use them really more than 1 month, some maximum 3. If you need antibiotics to keep your acne under control, you need Accutane. So let's say you treat them for a month, they look great, and then they flare immediately. That's an indication for Accutane, even in the absence of other signs of severity. So from my perspective, this is calming down the inflammatory lesions while you're allowing the retinoids to work. And if they can then bridge to topicals alone, great, or topicals plus hormonal treatment, or you're talking about moving on. We prefer doxycycline because there's much less side effects in terms of the rare but severe side effects associated with minocycline. Doxycycline is sun sensitizing, so in the summer, you have to think about that, and dosing we can talk about afterwards. Hormonal acne, again, a full talk in and of itself. Just be aware there are multiple treatments FDA approved, including topical treatments, which is called clascoterone. Also, the brand name is Winlevi. Not a huge fan. I don't think it's super effective, but if you have mild hormonal acne and someone doesn't want systemic treatment, you could give it a shot if it's covered by the insurance. Otherwise, as you know better than me, OCPs, spironolactone are our mainstay of treatment for female hormonal acne. So isotretinoin, wonderful medication, curative in 6 months of treatment. How many drugs in medicine in general cure you and you're done? It's a wonderful medicine. It's a gold standard for treatment of acne. It comes with a lot of regulatory burdens due to its teratogenicity, potential for teratogenicity in female patients. So you do have to be registered in iPledge. You have to see patients every month, regardless of gender. And for female or people who have childbearing potential, you have to have monthly pregnancy testing and so on. So because of that, generally speaking, most of the time, these are referrals to dermatology, although I see colleagues in the audience here who do, I know, prescribe isotretinoin. So the key thing here is, number one, recognizing severe acne, getting them to us, doing those precursor medications so that we can get them started right away. And I know there's a lot of controversy, and you may have questions about the psychiatric comorbidities. There's a lot of data controversy, even mostly debunking those connections, but keeping in mind that children really suffer, causes severe self-esteem and depression to have the severe acne and look different than your friends. And we are very successful in treating kids, even with psychiatric comorbidities. We do get a baseline PHQ-9 on everyone. If they have moderate or severe scores, we have them see our psychologist, who we're lucky enough, Dr. Julie Hired, to have embedded in our clinic. But even with having seen her, we've treated many children, even with comorbidities such as former suicidality, successfully. So yeah, you need to think about it and ask those questions, but it does not preclude treatment. Other side effects such as hypertriglyceridemia, et cetera, rarely occur. So just in conclusion for my portion, TikTok, they say this stuff cleared their acne. Most of those people took isotretinoin. Let's be real. They're selling things to our children. That's a waste of their money. It's also a focus on the self at the expense of what's really matters is our internal self. So we're spending so much time having these kids think about how they look and not who they are. And that's sort of my baseline beef with it, as well as it's not really honest. In terms of the gold standard for treatment of acne, you're going to start with, your retinoids and benzoyl peroxide and escalate as based on your physical exam. There is a little bit of data for low glycemic foods for those that would like that kind of complementary treatment, which I think is great anyway because it's healthier. And really, we want to partner with our patients. I want to meet them where they are. I understand you love TikTok and 400 toners and serums. Here's what we have, and try to find a way to work their products in a reasonable way. But mostly I'm taking things away. You need very few things to have a successful treatment, and don't spend time using drying products. Let's get the retinoid and use it properly. Thank you very much for your time.
So we started our conversation today asking about platforms that all of you use, and certainly what our teens are using. And we're going to talk just briefly again about what's out there, and certainly being aware of having those conversations with young people. And I will just point out again that many of our young patients are using platforms more commonly. Of course, the types of platforms that they're using have really evolved with, again, a lot more of TikTok and YouTube. What's also very interesting is that nearly half of young people say that they're online constantly, and that's really changed and up since maybe a decade ago, where only about 24% of young people said that. And you can see here that teen girls use TikTok more often, where boys are more likely to use YouTube. So there's certainly some gender differences as well. What are the benefits and challenges? We can certainly spend a lot of time talking about this. Working with young people, they'll say that they're, there's a lot of really wonderful things that are out there. And that includes, of course, things like creativity and connections. I have 2 teen boys at home, and sometimes when I come home, they're playing video games. I'd love for them to go outdoors and play a lot more, but I certainly see the benefit of those connections that they're having when they're playing with other young people. And that's what our teen patients tell us as well. Certainly, again, there's ways for people that are perhaps in more vulnerable or smaller communities to connect with each other online. We saw that during the pandemic. Again, it was a wonderful way to make those connections. What are some of the challenges that are out there with social media use? I know we've been certainly talking throughout our talk today about the issues related to skincare. What we do also worry about is that a lot of young people are just not getting enough sleep. There's this whole concept of what we call social jet lag, where they're just up a lot because they're on their phones or other devices, and they're actually really working with a sleep deficit. We know that a lot of young people are also more sedentary as a result of perhaps, again, being on video games or other things as well. There's certainly concerns about self-esteem, bullying, issues related to pornography and other things that they may be exposed to. And I'll just point out the paradox that comes with social media when we talk about, again, skincare, which is there's some really great information that's out there, but there's also some very unrealistic beauty standards, and certainly could put young people at very high risk for other issues related to, again, their own self-esteem. So I'll just point out that, again, social media, the relationship is not really linear, but actually U-shaped. This is work that comes out of the American Academy of Pediatrics, and certainly the Center of Excellence there, which is, again, a wonderful resource. And I'll just point out, again, it really has a lot to do with the type of media, certainly what they're exposed to. And I'll also say that parents and caregivers have a very big influence on that. And certainly I include myself as a parent and saying, when you're on your phones and you're on your devices, and certainly what you're doing really has an impact in terms of what young people are doing as well. So one of the metaphors that I think is really a wonderful way to think about this is the concept of teen driving. And in many communities, certainly here in the area as well, young people at some point are probably going to get a driver's license. I have a 16-year-old at home who is currently getting his driver's license, and we as parents have to be in the car for many hours with him. At some point, he will become more independent with that. In many states now, we are also deferring at what age young people start driving, because we think that the longer you can wait, it's better. In fact, I think the rental car companies are very smart because they don't rent cars to kids until they turn 21, knowing that the brain continues to keep developing. But my point here is that social media use in many ways is very similar. But there's ways if we can delay that, delaying again when you get young people the ability to have that, but knowing at some point that we're also going to be supporting them as caregivers and certainly as providers in terms of having good conversations, knowing what's out there, and then getting them to become independent and being thoughtful in terms of their use, and certainly protecting those people that might be at higher risk in terms of supporting them as well. So what are some things that you might want to think about as we, again, think about our patient, but certainly as we're working with young people and we're thinking about social media? And I'd like to impart to you the concept of the 5 C's. So again, what's a child like? Is it someone that can easily disengage from media use, or someone that takes a very long time and is watching it over and over again, and certainly might be much more vulnerable in terms of what they're seeing? What's the content? So is it Khan Academy or something very educational, or is it something that could be very violent or intense? And again, when we talk about skincare, something that they're very, very much affected by. Is it something that they're using to calm themselves? Are they using it to kind of go to sleep at night, which again can be a red flag? Is it crowding out other things that are important in their life because they're only on it and they're only thinking about it? Do they not have space for their schoolwork or sleeping or eating or being with their family or having those other connections? And certainly that idea of having that communication early. And I would say that if you are going to hand the phone or device or anything to a child, starting to have those conversations about things like pornography or sexting, and again, about TikTok and all of these other different platforms that kids may get exposed to and what they might be seeing, but having those conversations early and over again. These are some wonderful resources that are available if you are interested in thinking more about media platforms. And there's some really good ones for parents, but also providers. So certainly encourage you to think about that and look at it. And I'll come back to our case and just say that, again, you have a young person that's following a lot of influencers. I know Dr. Torga talked again about what young people are seeing, and certainly sometimes some very unrealistic kind of routines that are out there. And this young person's tried a lot of products. She's certainly not seen improvement, but I think what's also really concerning is that it's starting to affect her self-esteem. And so the question to all of you is, what would you do? So if we had more time, I'd have you turn to each other and ask that question. But I want you to again think, what would you do with this young person if you're working with them? So some ideas to think about are certainly what are the contributing factors, as Dr. Kirkorian pointed out, what are the skincare routines that this young person might be using? And again, really asking them, what's out there? What are you using? What have you heard about? I think can be very helpful. And certainly some of the things that, again, we've learned today in terms of what might be better routines and certainly things that can be more realistic. And the final piece, of course, is talking about social media. And I think a lot of our recommendations now is not talking about the amount of time you're spending on it, but being curious about what the platforms are and being not judgmental. I think teens think that's a much better approach when we're talking about social media, but also asking about how it's affecting them. Are you still feeling good about yourself? Are you feeling down? Do you not feel good about what you're seeing? Those are also really important questions. So I'd like to, again, just end by saying that these are some recommendations and some takeaways when we talk about skincare and social media. And again, it's really important for all of us as providers, as parents, to think about addressing those misconceptions, really being curious about what that online information is, and certainly thinking about strategies for young people to be more thoughtful in terms of the information they're getting from influencers or other people. I think I love the line that Dr. Kirkorian said that maybe they're already using isotretinoin as it begins with, and probably not just benefiting from all the other things that we're talking about. Certainly screening them for mental health concerns. And again, coming back to this concept of how do we build this more into our anticipatory care. As a pediatrician, adolescent medicine provider, I use acne as my clinical hook. Even if they have one pimple, I try to treat that because I know young people are worried about it, but it's a great way to come back for all the other high-risk issues. So certainly being familiar with it, asking about it, treating is important, but also then screening for these other things I think are also very useful. These were the objectives for our talk today, and hopefully we again have had you realize a little bit more about what's out there with young people and social media platforms, certainly some of the really good evidence-based approaches, and certainly again that interplay between social media and young people and some of the things that you might want to think about. And with that, we thank you.